Man, it's kind of cloudy outside.
It is.
You know what wasn't cloudy this week?
What wasn't cloudy?
This week's news in clinical AI.
By the way, where are we?
We are at my college, CU Boulder.
3 topics this week. First topic, a new study published in Gastroenterology about using AI, simple data from the electronic health record to predict certain forms of esophageal and stomach cancer. This is really exciting because it is yet more evidence that simple data elements fed through a machine learning process can identify patterns that will allow early prediction of pretty tough diseases. So esophageal cancer and stomach cancer are rising in their incidence levels, which is concerning. So this is another example of how we can use AI models and simple EHR data to predict onset of disease.
Do you think AI is going to be able to predict the number of cases during the hot Cheetos and Takis era?
The hot Cheetos and Takis era. You mean the bad teenager diet era? I think the data that was used to create this AI model came from before hot Cheetos and Takis were really a thing. But given the typical teenager diet, this is definitely worth studying.
New research topic coming soon. Do you think our senators are going to be able to figure out a way to regulate AI?
That is a question posed by the New York Times this week in a column called The Upshot. It looked back at prior attempts by the federal government to create new regulation of new technologies. And the latest technology is AI, of course, and there's lots of concern about its safety and validity.
You know, I trust them to regulate AI just about as much as I trust them to show...
You're on camera. Topic 3, a Pink Floyd song made with AI. So this is serious and a really fun article from the past week in the Washington Post. Researchers at UC Berkeley recorded patients' brainwaves as they listened to a Pink Floyd song, Another Brick in the Wall. And then they took that brain activity data, they fed it back through a machine learning algorithm, and the machine learning algorithm reconstructed the song from the patient's recorded brainwaves. This was just fascinating, and it points to the ability of being able to tell what people are listening to by tracing their brain activity.
Whoa. So you're telling me eventually you're going to be able to figure out all the TikToks I've been watching?
Only if you walk around with electrodes connected to your head.
Oh my God, Dad, look.
What?
It's another brick in the wall.